it actually depresses the eye and turns it laterally. Now the lateral motion here is not as significant as the depression motion, but you're going to learn it this way. Let me tell you how I remember it. I know it's stupid, but this is how I remember it. The superior one goes down and the inferior one goes up. It's opposite. The superior rectus elevates the eye, but the superior oblique depresses it. The inferior rectus depresses the eye, but the inferior oblique raises it. So it's just the opposite of its name. The obliques move the eyes opposite their names. Inferior oblique elevates in lateral, superior oblique depresses in lateral. Okay, so this picture has a lot of information on it, right? But all of the information on this picture is tied up in the acronym, or whatever that thing is called that I taught you. LR6S043. The abducens controls the lateral rectus. So an injury to the sixth cranial nerve would make it difficult to move the eye laterally. The superior oblique is innervated by cranial nerve 4. Injury to the trochlear nerve would cause the eye to have trouble moving up, down, and lateral. Right. Okay, so LR6S04. Now, why is the 3 on the end of that an acronym?
Because all the other ones are restaurants.
All the rest of them get 3. And that's why the nerve is called the oculomotor nerve. That's why it's named that, the oculomotor nerve. Oculo means eye, motor means skeletal muscle contraction. So 4 of the 6 are controlled by cranial nerve 3. All right, now the last one is this one to mention, the levator palpebrae superioris. And this is the primary mover of the upper eyelid. It is the reason, it is the answer to the question, which eyelid of your eye actually helps you open your eyes. The truth is, we don't move the lower eyelid. It moves some with the orbicularis oculi when the eyes close. But the opening of the eyes has very little to do with the lower eyelid. It's an upper eyelid function. Palpebrae means eyelid. And this one's going to elevate it, and it is attached, you can see, just above, very near, where that trochlea is. This is a fascinating muscle attachment right here, the levator palpebrae superioris. It actually fuses into the eyelid. This muscle does. All right. Now, I have its attachment here. It's attached to the lesser wing of the sphenoid. Now, does that make sense from what you know about the anatomy of the eye? The levator palpebrae superioris, attached to the upper eyelid, is attached to the lesser wing. Where in the orbit of the eye is the lesser wing of the sphenoid? It is superior to the greater wing, exactly. So it's the top of the back wall. And that's where the attachment of the levator palpebrae superioris is. All right. Now, let me stop there for just a minute before I move on and see if you guys feel okay with that. Let me tell you what you just learned, what I just dumped on you. I introduced the muscles of mastication to you. I used that as an occasion to introduce you to the trigeminal nerve. And in doing so, I taught you the openings in the skull through which the branches of the trigeminal pass. We then emphasized the mandibular branch of the trigeminal and its control of the muscles of mastication. And I did a dissection for you and taught you those muscles of mastication, where they're attached. So now you have a general scheme for the attachments of the muscles of mastication and their innervations. Now, since I had introduced the trigeminal to you and mentioned the ophthalmic branch of the trigeminal passing through the superioral fissure, I used that as an occasion to review with you very briefly the idea that the 7th cranial nerve carries parasympathetic information to the lacrimal gland. And I said, look, it is sharing the pathway with the branch of the trigeminal going to the lacrimal. And you know what else? There's some other things that pass through that superior orbital fissure, and those are the nerves that control the extrinsic eye muscles. And I use that as an occasion to teach you the names, attachments, and innervations of the extrinsic eye muscles while we were in the orbit of the eye. The only other thing you picked up from me at that point was that the optic nerve passes through the optic canal of the lesser wing for vision. Okay, so we'll return to that one. Okay, so I have, in essence, what I've done at this point, in my logic of thinking here, is I've talked about the muscles and big picture innervations of this stuff. We looked at the face, the facial bones. We looked at the attachments and the innervations of the muscles that are attached here. You should be able to do a face dissection and say all of the general things about the muscles and the innervations of those muscles in this area of the head. So we're just going to begin to work our way back that way. Now, along this side, you've already learned something. The temporal bone, you guys know already, the flat portion is the attachment of a muscle called the temporalis. You learned it because it's a muscle of mastication. It gets innervation by the mandibular branch of the trigeminal. And you know that that muscle passes deep to the zygomatic arch to attach to the coronoid of the ulna. The coronoid of the mandible. You won't get that confused with the coronoid of the ulna, will you? And you won't get that confused with the coracoid of the scapula, will you? We mentioned both of those. We talked about the pterygoid, the lateral pterygoid that attaches to the condyle here, and the medial pterygoid that attaches down here from mastication. And so now we can talk some more about this temporal bone. So first, let's notice that the temporal bone has a mastoid process here. It is the bony knot behind your ears. That bony knot serves as a very important anatomical landmark for, as I mentioned to you already, very briefly, for a bone conduction test called a Rhines test for hearing. The mastoid process, as we will also see, is a very important attachment for muscles. In fact, you have already learned about an important muscle attached to the mastoid process in the laboratory. It's the first one on the list, isn't it? What's it called? The sternocleidomastoid, or the sternomastoid, attached to that process. Attached to the manubrium and to the mastoid process. Now, this hole right here, just anterior to the mastoid process, is the external acoustic meatus. And inside there are the ossicles, the three tiny bones in the middle ear canal. Now, you can't see that in your head because you have an eardrum that's attached to them. But in a skull that you would purchase from Carolina that's a real skull, if you look inside that hole, you would see those three little bones. Now, how many of you in the laboratory looked at the temporal bone and wondered to yourself, could I stick something through the temporal bone into my brain? Did y'all wonder that? Is there a hole on the other side? What's it called? The internal acoustic meatus. Okay, did any of you try that? Good. That's what destroys the ossicles. People stick probes in there. The truth is you can't stick a probe right through the other side, and the reason for that is attached to the ossicles inside the temporal bone is what we call the inner ear. It is a bone within a bone. And it actually sits between the middle ear cavity and the opening of the internal acoustic meatus. It's called the vestibulocochlear apparatus. It's the place in your temporal bone where you do balance and hearing. And so that's what's inside here. Inside the external acoustic meatus, there's three little bones. We call them the ossicles. They are attached to what we call the inner ear. It's another bone, a bone inside a bone. On the other side of that inner ear bone, there's an opening that actually goes into the head. And so that opening is called the internal acoustic meatus. And you can see that there are some things that pass through this internal acoustic meatus. In fact, you knew part of this already. You knew, for example, in the parasympathetic nervous system, when I taught you about cranial nerve 7, when I taught you cranial nerve 7 controls the muscles of expression, I said this is how it gets there. It comes off of the brain and it passes through the internal acoustic meatus. And then it comes out in another hole in the temporal bone, so it stays inside the temporal bone, exiting by way of the stylomastoid foramen on its way to the muscles of expression. Okay, so this is the second time that you've heard the traversing of the 7th cranial nerve through the internal acoustic meatus. The one that I've not mentioned to you yet is this one, cranial nerve 8, which has 2 major branches that come off of the inner ear. The inner ear is made of 2 pieces, and it's reflected in the name of the nerve. What is the name of the 8th cranial nerve? The vestibulocochlear nerve. Cranial nerve 8 is the vestibulocochlear. It comes off of the inner ear and goes to the brain through the internal acoustic meatus. Cranial nerve 8 is named for the 2 pieces of information that it carries. Vestibulo is balance, and cochlear is hearing. Balance and hearing information is in the 8th cranial nerve passing through the internal acoustic meatus to the brain. And that's a hole in the temporal bone. All right? Let's work our way back now. If we work our way back from the internal acoustic meatus and we move down to the floor, this is not a very good picture, but I like it because I can color the blood vessels red here. If you move to the floor of the temporal bone, the next hole there is the carotid canal. And passing through the carotid canal are the internal carotid arteries supplying blood to the brain. Now, when I started this introduction with you of the skull, I said, look at the artery passing through the hole in the frontal bone. We called it the supraorbital artery. And I said, the really unique thing about this blood vessel is it brings up a principle that we will return to over and over again in the way arteries do things. The supraorbital artery is actually the terminal branch on the skull of the internal carotids. Now that would be a journey. Up the internal carotids, through the carotid canal, finding my way through the eyes, into the supraorbital foramen and out the skull on the other side. I also told you that it's going to anastomose with the terminal branches of the external carotid artery. That last branch being called the superficial temporal artery. In other words, this part of my head can get blood from either the internal or the external carotid artery. It's not really that important. But it let me introduce to you the concept of anastomosing blood vessels. This is the second one that you've seen here. The internal carotids supply blood to the brain. As the internal carotid arteries pass through the carotid canal, they feed a circle of blood vessels. This one is really important, and we will return to the details of this one. It feeds a circle of blood vessels called the circle of Willis. A circle of vessels around the pituitary gland at the level of the sella turcica. I'm saying anatomy words that you recognize where the pituitary is. And you can see very clearly in any brain, sheep brain or otherwise, you can see the circle of vessels right around that pituitary gland. The carotids feed the front of it. The back of the circle are supplied by 2 additional blood vessels called the vertebrals. So there are 4 blood vessels that feed a circle of blood vessels on the bottom of your brain. 2 of them are known as the internal carotid arteries, and they pass through the carotid canal of the temporal bone. Learn it now. It's never going away. We'll return to it again. So the vertebrals are the other 2, and you don't know how they get there, but you will. Okay. Now, the other, so I work my way posteriorly from the carotid canal. I like the picture because it has blue on it, and all the students see the blue and they go, vein. Okay, this one is the internal jugular, and these internal jugular veins are responsible for draining the brain. Okay, so let me tell you what you're learning about the importance of this temporal bone. Let me tell you what you're learning. There's a hole on the outside that you hear through. There's a hole on the, what's the name of that hole? External acoustic meatus. There's a hole on the inside that delivers balance and hearing and transmits the nerve or facial expression called internal acoustic meatus. The expression nerve passes out a hole in the temporal bone between the styloid and mastoid process called the stylomastoid foramen. Okay, so hearing, balance, muscles of expression, in the sense about how important this bone is, right? Mastication, the temporalis is attached to it, right? And then, now we're getting a hole through which 50% of the blood supply for the brain arrives, the carotid canal. And now, we're learning that the temporal bone also has a hole in it that drains all of the blood out of the brain. These are the internal jugular veins. They're huge blood vessels that are attached to the sinuses around your head. Not the sinuses in the bones, a different group of sinuses in the meninges. And they carry blood out of your brain. Y'all, the temporal bone explains how does blood get to the brain and how does blood get out of the brain. Carotid canal 2, jugular foramen out. Internal jugulars from the brain pass to the major branches of the venous system, the brachiocephalicus, into the superior vena cava, and right into the heart. This is the drainage pathway for the brain, the internal jugulars. Now, what was the difference in the anatomy, what was the difference in the lab between the size of the jugular foramen and the carotid canal? When you saw them, all the skulls in the lab, what's the difference in the two?
The carotid.
Which one's bigger?
The jugular.
The jugular, exactly. It's posterior to the carotid, and it's huge, right? It's a big opening. And there's a reason for that. It's not just blood in that opening. There are also nerves. 3 cranial nerves pass through these holes, 3 on each side. They are the 9th, the 10th, and the 11th cranial nerve. The glossopharyngeal, the vagus, and the accessory all pass through the jugular foramen. All right, so let's see. There's some things we know already, yes? If I say the 9th cranial nerve, don't look at the picture. If I said the 9th cranial nerve, what's the first thing that comes to your mind? Okay, glossopharyngeal, good. What's next? Parasympathetic, because you learned parasympathetics are on 3, 7, 9, and 10. Exactly. Now, if I asked you how many sets of salivary glands there are, what would you say? 3 sets. Can you name them? Submandibular, sublingual. Okay, yeah, in the cat that's true, but in humans it's submandibular, sublingual, and we did it today. It goes in at the 2nd molar.
Parotid.
The parotid gland, yeah. Okay, and then I pointed this out to you. I said, look, the 7th cranial nerve supplies the lacrimal and the submandibular and sublingual. But which parasympathetic nerve goes to the parotid? 9th. Exactly. So there it is for you. We did it before, so this is the 2nd time. The glossopharyngeal supplies for parotid salivation. Now, you also do this. Taste from the posterior third. What does that mean? Okay, so can you deliver sensory information from the tongue by way of nerves? Anterior third. This is the very end of class last time. Anterior third is 7. Facial. Middle third, glossopharyngeal. Posterior, vagus. Right? Didn't we look at this picture last time? Facial, cranial nerve 7. Glossopharyngeal, here, cranial nerve 9. And posterior aspects, cranial nerve 10. Supplying sensory information, these 3 cranial nerves. Okay? So how does the information get there? How does it get there? How does the information from 9 and 10 get to where it's going?
jugular.
If the cranial nerve 7 comes off of the brain, if the cranial nerve 9 comes off of the brain and it passes through the skull to go places, it can't just get out without a hold. Okay, so these nerves pass through the jugular foramen. Let me finish with this one, and then I'll pick up here next time. You knew this about the rear tongue stuff right here, but let me finish with this one, the carotid sinus. Okay, so the carotid sinus is listed here for the glossopharyngeal. And I've mentioned it now twice for you. The carotid sinus is where the external and internal carotid split. Where is it? 2 fingers
Below the mouth.
below the angle of the ramus of the mandible. Yes, the carotid sinus is where internals and externals split. Now, I mentioned this as an aside. I didn't really want you to, you didn't have to pick it up at that point. That this is a place really important for blood pressure and breathing. For your body to control blood pressure and breathing. Now, when we get to the respiratory system, you're going to learn the brain structures that do that. And it's true, your brain is the main regulator of breathing. However, there are places in your body that deliver information to your brain about blood pressure and breathing. And they are the carotid sinus and the aortic arch. We're going to learn, after we do all the autonomic motor stuff for 9 and 10, that there's sensor information on these nerves as well. It is uniquely important to your teacher. Because Faith, bless her heart, if she could ever get through all the data we collected in the spring, she can write a paper on this. The 10th cranial nerve has breathing information in it and heart information in it. And you can measure it. You can see that there's a corresponding cycling of breathing and heart rate that occur in people. And we tested an entire psychology class in the spring. We have the data, 7 gigabytes worth of it on a flash drive that she's wading through right now. I'll tell you what she's going to find. There's a link there between what the vagus is doing and, I'm talking about you, Faith.
I did.
There's a link there between what the vagus is doing for respiration and heart rate. The question is, how does that information get to your head? This is the end of today. The 9th and 10th cranial nerve are going to deliver that information to the brain through the jugular foramen. That's how it gets there. Okay, so we'll pick this up next time and continue on exploring our head and neck.